Hi, welcome to another one of our Dr. Foot videos. In this video, I'm going to be talking about the 5 products you should not be using on your feet. Number 1, and probably the most important to me, is a product called Bazooka the Veruca. The reason why I dislike this with a passion is, one, patients use this on corns or verrucas that have not been diagnosed. So they often use it on skin that is not a corn or verruca, and then they cause a chemical burn. Bazooka the Veruca has got a very powerful acid in there. It's a reason why it's called Bazooka the Veruca. It blows a hole in your foot. I see patients every couple of weeks who've got an infection, full on pus and everything coming out of their lesion because they've used Bazooka the Veruca on a lesion that was inappropriate, or they've carried on using it, or they've used it on healthy skin and they've burnt healthy skin. Then I have to treat the lesion, I have to give them antibiotics. Don't use it, please don't use it. If there's one reason I would go on a march and hold up a placard and do a petition, it would be so that patients can't buy this product. It's a very powerful caustic. As you can see, I'm very passionate about patients being able to use this. There are a few circumstances that I do recommend to patients to use it, and I'll tell you when. Now, when a podiatrist takes the hard skin off a lesion and they can clearly see the circumference of either the verruca or the corn, and they can point out to the patient, here it is. I often take a picture of it and I show the patient, this is exactly the spot I want you to put it on. I don't want you to slap it on everywhere. It's not like you're painting a house with it. You just want to put it on a very small area. So that's the first product, Bazooka the Veruca. If you're going to use it, go and get some advice from a HCPC registered podiatrist who can tell you what the lesion is and tell you where to put it. Number two, Vicks. Ugh. Why are people putting Vicks on their toenails? It's not going to make your fungal toenails go away. It's great. It's absolutely great for a cold. Put it in your chest, but don't put it on your feet. It's not going to make your fungal toenails go away. So that's my number 2 product. Number 3, tea tree oil. Great if you've got a spot. Not so great if you've got fungus, if you think you've got fungal nails. Similar to Vicks, people use it on nails when they think they have a fungal nail infection. It hasn't been diagnosed by a podiatrist. We've done no tests on the nail. We haven't assessed the nail. You don't know if it is a fungal nail. So visit a podiatrist first of all to have it assessed. But don't put tea tree oil on a toenail. It will damage the nail. It will take off the healthy bit of the nail, the healthy layers of the nail. You'll cause more damage. And as with Vicks, there's no evidence to prove that it works. Like, you've got to have some evidence that a product works for your toenails. You don't just put it on. So yeah, don't use tea tree oil. The reason why people do this is because they go to Dr. Google instead of going to Dr. Foot or another podiatrist. Visit a podiatrist and get some advice. Number 4. Number 4, and one that winds me up also, it is vinegar. Ugh. Why are people soaking their feet in vinegar to get rid of tinea pedis or athlete's foot? There's no evidence to prove it works. You can put it apple cider vinegar, you can use balsamic vinegar. I've heard all sorts of stories. The only place you should put your vinegar is fish and chips. Put loads of it on fish and chips. Don't put it on your feet, for God's sake. It's not going to get rid of your fungal nails. It's just not, or your athlete's foot. So that's my number 4. Number 5. It's not a product as such, but it is sort of patients that get a blade and cut away at their lesions, causing so much damage. I've had patients use nail clippers to cut away at their hard skin, like Hannibal Lecter going for it, The Shining going through the door. Like, just look, we take it off. We take the hard skin and corns off in very thin layers, very thin layers. Visit a podiatrist. Don't hack away at it yourself. You don't try and get a scene from Hannibal Lecter going. I've had patients, I'm just thinking about these patients who've done bathroom surgery on their own feet, and they've cut away and they've created a wound, and they've cut away at healthy flesh. It's a sight to behold, honestly, and I'm sure I'm not the only podiatrist that will tell you this. Ask any podiatrist and they will tell you, like, don't hack away at your own feet. If you've got hard skin, get a skin file. Use a cream like Flexitol, CCS foot cream. There's so many other really good foot creams out there. You can buy from Boots, even cocoa butter, and get a file or a pumice stone. Even that Pedeg, I really don't like it. It's like a cheese grater, and you're going for your foot. So don't hack away at your foot. As you can see, I don't like patients doing these things to their feet. God's only given you 2 feet. I mean, you're not going to cut them off and put a new one. We haven't progressed that far with like 3D printing that I can give you a new foot. Once you've damaged your skin and your foot, it can be permanently damaged no matter what we try and do for it. Hope you found this video interesting. I better get back. I don't know if I've got 15 minutes before my next patient, so you can guess what I'm going to do. I'm going to go and get a coffee. And I shall speak to you soon. Take care. Bye.